Scientists in Japan developed a single injection that regenerates damaged cartilage and stops arthritis pain permanently. Not painkillers. Not surgery. Not steroids. One injection, and your joints start repairing themselves. Here's what they discovered, and why this changes everything for people over 50. If you wake up every morning with stiff, aching joints, if climbing stairs feels impossible, if arthritis is stealing your mobility, listen closely. Because right now, in Japan, researchers are using something called stem cell exosomes to completely reverse joint damage. And by the end of this video, I'm going to tell you about a 62-year-old woman who could barely walk, got one injection, and 3 months later was hiking mountains. No more pain. No more stiffness. Just healthy, regenerated cartilage. But first, let me show you why everything you've tried so far has failed. Here's the brutal truth about arthritis. Every treatment you've ever tried only masks the symptoms. Painkillers? They numb the pain, but your cartilage keeps deteriorating. Physical therapy helps temporarily, but doesn't regenerate damaged tissue. Cortisone shots work for a few months, then you're back where you started, or worse. And surgery? Joint replacement, $15,000 to $30,000, painful recovery, and the artificial joint only lasts 10 to 15 years. Here's what nobody tells you. Your body actually has the ability to regenerate cartilage. You did it when you were a child. The instructions are still in your cells. They're just turned off. Scientists in Japan figured out how to turn them back on. And the results? 70% pain reduction, cartilage regrowth visible on MRI scans, patients walking pain-free after just one injection. This isn't managing arthritis. This is reversing it. Here's how it works, and I promise, it's simpler than you think. Scientists extract something called exosomes from mesenchymal stem cells. Now, what are exosomes? Think of them as tiny messenger particles, packed with healing instructions. They're like microscopic delivery trucks carrying blueprints for tissue repair. When injected into your knee, these exosomes travel directly to damaged cartilage cells. They deliver 3 critical signals. Signal number 1, stop inflammation. The exosomes shut down the inflammatory response that's eating away at your cartilage. Signal number 2, start regeneration. They activate dormant repair genes in your chondrocyte, those are your cartilage-producing cells. Signal number 3, rebuild the matrix. The exosomes trigger production of collagen and proteoglycans, the building blocks your cartilage needs. Within weeks, your body starts rebuilding cartilage that hasn't existed in years. Now here's the part that makes this revolutionary. Unlike stem cell injections, which can be unpredictable, exosomes are cell-free. No risk of rejection. No ethical concerns. Just pure biological signaling. And the studies? 28 preclinical trials, over 600 patients in Japan, 70% showing significant improvement. But you're probably wondering, what does significant improvement actually mean? If you're finding this valuable, do me a favor and tap that like button. It helps more people discover this breakthrough, and honestly, it might save someone's mobility. Alright, let me tell you that story I promised. Because this is where it gets real. Her name was Yuki. 62 years old. Grade 3 osteoarthritis in both knees. She'd tried everything, physical therapy, cortisone shots, anti-inflammatory drugs. Nothing worked. Her doctor said, "You need knee replacement surgery. Both knees. There's no other option." But Yuki was terrified of surgery. So she enrolled in a clinical trial at Tongji Hospital in China. Testing these stem cell exosomes. 1 injection. Each knee. 5 minutes total. The first week. Nothing changed. She was skeptical. Week 2. The morning stiffness started fading. Week 4. She could climb stairs without gripping the railing. Week 8. The pain was almost gone. 3 months later, they did an MRI scan. Her doctor couldn't believe it. The cartilage had visibly regenerated. Areas that showed complete degradation before now showed healthy tissue. Yuki went hiking. For the first time in 5 years. No surgery. No replacement joints. Just one injection that triggered her body's natural healing response. Now, before you get too excited, let me be clear. This doesn't work for everyone. If your cartilage is completely gone, if you have bone-on-bone arthritis, this won't rebuild what's not there. But for grade 1, 2, or early grade 3 arthritis, the results are remarkable. So, how does this actually regenerate cartilage? Let me break. Your immune system has two types of macrophages. M1, which cause inflammation, and M2, which promote healing. The exosomes flip the switch, converting M1 macrophages to M2. Your immune system stops attacking your joints and starts repairing them. This is why the results last. You're not just suppressing symptoms. You're fundamentally changing your joint's biological environment. Now, the question everyone asks: who should consider this treatment? If you have morning joint stiffness that lasts more than 30 minutes, you're a candidate. If you have pain that gets worse with activity and better with rest, you need this. If X-rays show joint space narrowing, you're in the window where this works best. Here are the red flags that mean you should act now. Grade 1 or 2 osteoarthritis on imaging. Persistent pain despite physical therapy. You're considering surgery but want to avoid it. You're over 50 and noticing progressive joint problems. Here's what most people don't realize: the earlier you intervene, the better the results. Waiting until your cartilage is completely gone, that's too late. But catching it early, that's when regeneration is most effective. So, when will this be available, and how much will it cost? Here's the current status. In Japan and China, this is already available in select hospitals and clinics. Clinical trials ongoing. Early adopter access. In the United States, FDA trials started in 2024 at Mayo Clinic and Johns Hopkins. Expected approval, late 2026 to early 2027. Cost right now in Asia: around $3,000 to $5,000 per injection. When it reaches the US, probably $5,000 to $8,000 initially, dropping to $3,000 to $4,000 as it becomes standard. Compare that to knee replacement, which costs $20,000 to $30,000, plus months of painful recovery. One injection. $3,000. Walk away the same day. And here's the timeline for results. Week 1 to 2, inflammation starts reducing. Week 4 to 6, pain significantly decreased. Week 8 to 12, cartilage regeneration visible on imaging. Most patients see 70% pain reduction within 3 months. Now, what can you do today if you're not in Japan or China? If you can't access exosome therapy yet, here's what to ask your doctor for. First, PRP therapy. Platelet-rich plasma. It's similar, uses your own blood's healing factors. Available now in most major cities. Second, hyaluronic acid injections. Not as powerful as exosomes, but they do provide lubrication and mild regeneration. Third, supplements. Glucosamine, chondroitin, and collagen type 2. They won't regenerate cartilage, but they support what you have left. And fourth, if you're willing to travel, medical tourism to Japan or South Korea for exosome therapy is an option. Many clinics cater to international patients. The future? Your own body repairing your joints. No surgery. No replacements. Just regeneration. And it's closer than you think. So, which option interests you most? The exosome injection when it's available. PRP therapy now. Or medical tourism? Drop your answer in the comments. I read every single one. And if you want more breakthroughs like this, hit subscribe. We cover life-changing medical discoveries every single week. Watch this next video. It's about another regenerative treatment that sounds impossible, but it's real. This is Lab to Discovery. Take care of your joints, and I'll see you in the next one.